You forget a name and it comes back later. You walk into a room and pause, wondering what you came in for. You misplace your glasses, then find them on the counter. Most people can laugh at moments like that. But after 60, even a small memory slip can land differently. It can raise a quiet question you may not want to say out loud. Is this normal, or is something beginning to change? That question is not foolish. It is human. Memory is personal. It is tied to independence, confidence, family, identity, and the ability to manage daily life. So, when memory feels less sharp, it can be unsettling. But here is the important truth. Memory slips after 60 do not automatically mean dementia. They do not automatically mean Alzheimer's disease. They do not mean your brain is failing. At the same time, memory changes should not always be dismissed as just aging. The safest place is in the middle, not panic and not denial. The real question is the pattern. Is it occasional or happening more often? Is it staying the same or getting worse? Is it only when you are tired or distracted, or is it affecting daily life? Did it start suddenly? Did it begin after a medication change, poor sleep, illness, grief, stress, or a fall? Those details matter. This video is for education only. It cannot diagnose the cause of memory changes, and it does not replace medical advice. But it can help you understand what may be normal, what may deserve attention, and when it is time to talk with a qualified healthcare professional. As we age, the brain does change. It may take longer to learn something new. It may take longer to recall a name, a word, or where you put something. You may need more reminders than you used to. You may pause during a conversation and then remember the word a minute later. That can be frustrating, but it can still fall within normal aging. The difference is whether memory problems start interfering with life. There is a big difference between occasionally forgetting where you put your keys and not recognizing how to get home from a familiar place. There is a difference between forgetting a name and not being able to follow a conversation. There is a difference between making a small mistake and no longer being able to manage bills, medications, appointments, cooking, or routines you used to handle well. That difference is where the conversation becomes more serious. One common misconception is that any memory slip after 60 means dementia. That is not true. Memory problems can come from many different causes. Some are related to brain changes, but many are connected to sleep, mood, stress, medications, hearing loss, thyroid problems, vitamin B12 levels, alcohol, blood pressure, diabetes, infections, or sudden illness. That is why guessing can be misleading. One person may fear dementia when the real issue is poor sleep. Another may blame stress when a medication side effect is part of the problem. Someone else may say, "I'm just getting older," when memory changes are clearly affecting daily life and need evaluation. The goal is not to label yourself. The goal is to notice what kind of change is happening. A normal age-related memory slip might look like forgetting a name but remembering it later, misplacing an object, then finding it, taking longer to learn a new phone or a new app, needing to write things down more often, walking into a room and needing a moment to remember why. These moments can be annoying. They can even be embarrassing, but by themselves, they do not necessarily point to something serious. Now compare that with a different pattern, repeating the same question again and again. Missing important appointments even with reminders. Getting confused about the month or year. Getting lost somewhere familiar. Struggling with a recipe you have made for years. Forgetting how to use an appliance you know well. Making unusual financial mistakes. Leaving the stove on. Losing track of medications. Having close family members say, "You seem different." Those patterns do not prove dementia, but they are worth discussing with a doctor. There is also a middle category called mild cognitive impairment. It's often called MCI. MCI means memory or thinking changes are more noticeable than typical aging, but not severe enough to significantly interfere with daily activities. A person may still live independently and manage most of life, but they or their family can tell something has shifted. Some people with MCI stay stable, Some improve if an underlying issue is found. Some later develop more serious cognitive problems. That is why follow-up matters. Not because every memory change is a disaster, but because understanding what is happening gives you more options. One of the most overlooked causes of memory trouble after 60 is medication. Many older adults take more than one medication. Some also take over-the-counter allergy pills, sleep aids, bladder medicines, pain medicines, mood medicines, or supplements. Certain medicines or combinations of medicines can affect attention, alertness, balance, and memory in some older adults. Some medications with anticholinergic effects, for example, can contribute to confusion or slower thinking in older people. These can include some older allergy medicines, some sleep aids, some bladder medications, some antidepressants, and other drug categories. That does not mean you should stop anything on your own. Do not stop a prescription, sleep medicine, allergy medicine, bladder medicine, antidepressant, blood pressure medicine, or any other medication because of a video. Stopping suddenly can be risky. But if memory problems started after a new medication, a dose change, or adding an over-the-counter product, it is worth asking your doctor or pharmacist about it. Bring the full list, not just prescriptions. Include vitamins, supplements, sleep aids, pain relievers, allergy medicines, and anything you only take once in a while. A medication review is one of the most practical first steps when memory feels different after 60. Sleep is another major piece. When you do not sleep well, memory often feels worse. The brain needs sleep for attention, learning, mood, and recall. Poor sleep can make you foggy, forgetful, irritable, and less able to concentrate. Sometimes a person thinks they have a memory problem when they actually have a sleep problem. This is especially worth asking about if you snore loudly, wake up gasping, feel sleepy during the day, wake with morning headaches, or never feel rested. Untreated sleep apnea can affect memory and attention, and it is worth discussing with a healthcare professional. Pain, nighttime urination, anxiety, restless legs, caffeine, alcohol, and medication timing can also break up sleep. So if your memory feels worse, look at the night before. Did this start during a season of poor sleep? Are you waking up exhausted most mornings? Are you trying to remember things while your brain is already tired? Mood matters too. Depression, anxiety, grief, loneliness, and chronic stress can all affect concentration and memory. When your mind is carrying emotional weight, it may not store or retrieve information as smoothly. That does not mean symptoms are all in your head. It means the brain and emotions are connected. Depression in older adults can sometimes look like memory trouble. A person may seem forgetful, withdrawn, slowed down, less interested in daily life, or unable to focus and make decisions. And depression is not simply a normal part of aging. It is worth addressing. Hearing is another factor many people do not connect with memory. If you are not hearing clearly, your brain has to work harder just to understand what is being said. That leaves less mental energy for remembering the conversation. A person may seem forgetful when they never fully heard the information in the first place. Hearing loss can also cause people to withdraw from conversations, restaurants, family gatherings, and social life. Over time, less connection and less mental stimulation can affect mood and thinking. So if you often ask people to repeat themselves, turn the television louder, avoid noisy rooms, or feel exhausted after conversations, a hearing check may be more important than you think. Memory does not happen in isolation. It depends on the whole system. Vitamin B12 is one example. Low B12 can affect the nervous system and may contribute to memory problems. Concentration issues, mood changes, balance problems, numbness, or tingling. This becomes more relevant with age because some older adults have more trouble absorbing B12 naturally from food. But that does not mean everyone with memory slips should start high-dose B12. The safer step is to ask your doctor whether testing is appropriate, especially if memory changes come with fatigue, numbness, tingling, balance problems, anemia, digestive issues, or dietary restrictions. Thyroid function can also play a role. An underactive thyroid can make a person feel slowed down, tired, foggy, depressed, and forgetful. These symptoms can overlap with many other conditions, which is why proper evaluation matters. Blood pressure, diabetes, and circulation are also connected to brain health. The brain depends on steady blood flow. High blood pressure can affect blood vessels over time. Diabetes that is not well managed can affect blood vessels and nerves. Smoking, heavy alcohol use, stroke risk, physical inactivity, and heart health can all matter for long-term brain function. This does not mean every memory slip is caused by circulation or blood sugar. But after 60, brain health is not only about the brain. It is also about the heart, blood vessels, sleep, metabolism, hearing, mood, and medications. There is one situation that needs a very different response: sudden confusion. Sudden confusion is not the same as gradually forgetting names. Someone becomes confused over hours or days, does not know where they are, cannot pay attention, becomes unusually sleepy or agitated, or is clearly not acting like themselves. That may be delirium or another urgent medical issue. Delirium can happen with infections, dehydration, medication changes, hospitalization, surgery, pain, or other illness, especially in older adults. It should not be brushed off as normal aging. And if memory problems or confusion come on suddenly with trouble speaking, facial drooping, weakness or numbness on one side, trouble seeing, trouble walking, severe dizziness, or a sudden severe headache, that could be a stroke warning sign. Call emergency services right away. Most memory slips are not emergencies, but sudden neurological changes are different. So what should you actually pay attention to? Start with frequency. Is this happening once in a while, or often enough that you notice a change? Is it stable or becoming more frequent? Then look at daily life. Are you missing bills, forgetting medications, getting lost, repeating questions, leaving appliances on, struggling with tasks you used to do easily? Notice whether other people are concerned. That can be hard to hear. No one likes being told they seem forgetful. But sometimes a spouse, adult child, close friend, or neighbor notices changes before the person does. If someone who knows you well is gently saying, "Something seems different," it may be worth listening. Also, pay attention to timing. Did the memory change begin after a new medication? After an illness? After a fall or head injury? After losing someone close to you? After weeks of poor sleep? After drinking more alcohol than usual? After becoming more isolated? These details can help a doctor understand what may be contributing. One simple habit is to keep a memory pattern log. Write down what happened, when it happened, and what was going on around it. Were you tired, stressed, sleeping poorly? Starting a new medicine? Recovering from illness? Did the memory slip affect daily life? A vague concern like "my memory is bad" can be hard to evaluate. A clear pattern like "I forgot to bills this month," repeated the same question several times, and this started after a new sleep medication is much more useful. Review your medications and supplements. Ask your doctor or pharmacist, could anything I take affect memory, alertness, sleep, balance, or confusion? That question is especially useful if you take sleep aids, allergy medicine, bladder medicine, pain medicine, anxiety medicine, antidepressants, or multiple medications. Do not stop medications on your own. Review them. Support sleep where you can. Try to keep a consistent sleep schedule. Pay attention to caffeine late in the day. Address pain that wakes you up. Ask about sleep apnea if you snore, gasp, or wake up feeling unrefreshed. Stay physically active if it is safe for you. Regular movement supports heart health, blood flow, mood, balance, blood sugar, and overall brain health. It does not need to be extreme. Walking, gentle strength work, stretching, or activity approved by your healthcare provider can all be part of a healthy routine. Manage blood pressure, diabetes, and heart risk factors with medical guidance. That may not feel directly related to memory, But brain health depends on healthy blood vessels and stable overall health. Check your hearing if conversations have become harder, and stay socially and mentally engaged where possible. You do not need expensive brain programs. Meaningful conversation, hobbies, reading, music, learning, volunteering, family connection, faith community, or group activities can all help keep life active and connected. If loneliness or depression is present, do not treat it as a personal weakness. It is a health issue worth addressing. So, when should you talk to a doctor? Talk to a qualified healthcare professional if memory changes are new, frequent, worsening, or affecting daily life. Talk to a doctor if you are repeating questions often, getting lost in familiar places, missing bills, mismanaging medications, struggling with familiar tasks, or if people close to you are noticing changes. Talk to a doctor if memory changes began after a medication change, illness, fall, head injury, major sleep change, mood change, or major life stress. Seek prompt medical attention if confusion comes on suddenly, especially over hours or days. And seek emergency care if memory problems or confusion come with sudden trouble speaking. Weakness or numbness on one side, trouble seeing, trouble walking, severe dizziness, severe headache, fainting, or major behavior changes. The main lesson is this: memory slips after 60 are not something to automatically fear, but they are something to understand. Occasional forgetfulness can be part of normal aging. But memory changes that disrupt daily life, worsen over time, begin suddenly, or come with confusion, mood changes, medication changes, sleep problems, or physical symptoms deserve attention. Do not assume the worst. But do not dismiss your body's signals just because you are older. After 60, the goal is not to fear every forgotten word. The goal is to notice when memory changes start affecting life. And sometimes the most important step is not buying a brain supplement, it is asking the right question at the right time. If this helped you understand memory slips after 60 more clearly, subscribe for more calm, practical explanations about health after 60, body signals, medications, sleep, blood sugar, circulation, nutrition, and the changes worth noticing before they become harder to manage.